don't stop. Don't stop. Don't stop. Don't stop.
Hyperthyroidism in pregnancy. The thyroid is a small, butterfly-shaped gland in the front of your neck that makes thyroid hormones. Thyroid hormones control how your body uses energy, so they affect the way nearly every organ in your body works, even the way your heart beats. The thyroid is a small gland in your neck that makes thyroid hormones. Sometimes the thyroid makes too much or too little of these hormones. Too much thyroid hormone is called hyperthyroidism and can cause many of your body's functions to speed up. Hyper means the thyroid is overactive. If you have thyroid problems, you can still have a healthy pregnancy and protect your baby's health by having regular thyroid function tests and taking any medicines that your doctor prescribes. What role do thyroid hormones play in pregnancy? Thyroid hormones are crucial for normal development of your baby's brain and nervous system. During the first trimester, the first 3 months of pregnancy, your baby depends on your supply of thyroid hormone, which comes through the placenta-NIH external link. At around 12 weeks, your baby's thyroid starts to work on its own, but it doesn't make enough thyroid hormone until 18 to 20 weeks of pregnancy. Two pregnancy-related hormones, human chorionic gonadotropin, HCG, and estrogen, cause higher measured thyroid hormone levels in your blood. The thyroid enlarges slightly in healthy women during pregnancy, but usually not enough for a healthcare professional to feel during a physical exam. Thyroid problems can be hard to diagnose in pregnancy due to higher levels of thyroid hormones and other symptoms that occur in both pregnancy and thyroid disorders. Some symptoms of hyperthyroidism or hypothyroidism are easier to spot and may prompt your doctor to test you for these thyroid diseases. Another type of thyroid disease, postpartum thyroiditis, can occur after your baby is born. 1. Hyperthyroidism in pregnancy. What are the symptoms of hyperthyroidism in pregnancy? Some signs and symptoms of hyperthyroidism often occur in normal pregnancies, including faster heart rate, trouble dealing with heat, and tiredness. Other signs and symptoms can suggest hyperthyroidism: fast and irregular heartbeat, shaky hands, unexplained weight loss or failure to have normal pregnancy weight gain. What causes hyperthyroidism in pregnancy? 1. Hyperthyroidism in pregnancy is usually caused by Graves' disease and occurs in 1 to 4 of every 1,000 pregnancies in the United States. Graves' disease is an autoimmune disorder. With this disease, your immune system makes antibodies that cause the thyroid to make too much thyroid hormone. This antibody is called thyroid-stimulating immunoglobulin, or TSI. Graves' disease may first appear during pregnancy. However, if you already have Graves' disease, your symptoms could improve in your second and third trimesters. Some parts of your immune system are less active later in pregnancy, so your immune system makes less TSI. This may be why symptoms improve. Graves' disease often gets worse again in the first few months after your baby is born, when TSI levels go up again. If you have Graves' disease, your doctor will most likely test your thyroid function monthly throughout your pregnancy and may need to treat your hyperthyroidism. 1. Thyroid hormone levels that are too high can harm your health and your baby's. Too rarely, hyperthyroidism in pregnancy is linked to hyperemesis gravidarum, NIH external link, severe nausea and vomiting that can lead to weight loss and dehydration. Experts believe this severe nausea and vomiting is caused by high levels of HCG early in pregnancy. High HCG levels can cause the thyroid to make too much thyroid hormone. This type of hyperthyroidism usually goes away during the second half of pregnancy. Less often, one or more nodules, or lumps in your thyroid, make too much thyroid hormone. How can hyperthyroidism affect me and my baby? Untreated hyperthyroidism during pregnancy can lead to miscarriage, premature birth, low birth weight, preeclampsia, a dangerous rise in blood pressure in late pregnancy, thyroid storm, a sudden, severe worsening of symptoms, congestive heart failure, rarely, Graves' disease may also affect a baby's thyroid, causing it to make too much thyroid hormone. Even if your hyperthyroidism was cured by radioactive iodine treatment to destroy thyroid cells or surgery to remove your thyroid, your body still makes the TSI antibody. When levels of this antibody are high, TSI may travel to your baby's bloodstream. Just as TSI caused your own thyroid to make too much thyroid hormone, it can also cause your baby's thyroid to make too much. Tell your doctor if you've had surgery or radioactive iodine treatment for Graves' disease so he or she can check your TSI levels. If they are very high, your doctor will monitor your baby for thyroid-related problems later in your pregnancy. Tell your doctor if you've had surgery or radioactive iodine treatment for Graves' disease. An overactive thyroid in a newborn can lead to a fast heart rate, which can lead to heart failure. Early closing of the soft spot in the baby's skull. Poor weight gain. Irritability. Sometimes an enlarged thyroid can press against your baby's windpipe and make it hard for your baby to breathe. If you have Graves' disease, your healthcare team should closely monitor you and your newborn. How do doctors diagnose hyperthyroidism in pregnancy? Your doctor will review your symptoms and do some blood tests to measure your thyroid hormone levels. Your doctor may also look for antibodies in your blood to see if Graves' disease is causing your hyperthyroidism. How do doctors treat hyperthyroidism during pregnancy? 1. If you have mild hyperthyroidism during pregnancy, you probably won't need treatment. 2. If your hyperthyroidism is linked to hyperemesis gravidarum, you only need treatment for vomiting and dehydration. 3. If your hyperthyroidism is more severe, your doctor may prescribe antithyroid medicines, which cause your thyroid to make less thyroid hormone. This treatment prevents too much of your thyroid hormone from getting into your baby's bloodstream. Doctors most often treat pregnant women with the antithyroid medicine propylthiouracil during the first 3 months of pregnancy. Another type of antithyroid medicine, methimazole, is easier to take and has fewer side effects, but is slightly more likely to cause serious birth defects than PTU. Birth defects with either type of medicine are rare. Sometimes doctors switch to methimazole after the first trimester of pregnancy. Some women no longer need antithyroid medicine in the third trimester. Small amounts of antithyroid medicine move into the baby's bloodstream and lower the amount of thyroid hormone the baby makes. If you take antithyroid medicine, your doctor will prescribe the lowest possible dose to avoid hypothyroidism in your baby but enough to treat the high thyroid hormone levels that can also affect your baby. Antithyroid medicines can cause side effects in some people, including allergic reactions such as rashes and itching. Rarely, a decrease in the number of white blood cells in the body, which can make it harder for your body to fight infection. Liver failure, in rare cases. Stop your antithyroid medicine and call your doctor right away if you develop any of these symptoms while taking antithyroid medicines: yellowing of your skin or the whites of your eyes, called jaundice. Dull pain in your abdomen. Constant sore throat. Fever. You should also contact your doctor if any of these symptoms develop for the first time while you're taking antithyroid medicines: increased tiredness or weakness. Loss of appetite. Skin rash or itching. Easy bruising. If you are allergic to or have severe side effects from antithyroid medicines, your doctor may consider surgery to remove part or most of your thyroid gland. The best time for thyroid surgery during pregnancy is in the second trimester. Radioactive iodine treatment is not an option for pregnant women because it can damage the baby's thyroid gland.